So,
Rhonda,
I just wanted to do.
What's your official title of the hospital?
I'm the financial coordinator for Southwest Health Systems. I wanted to do a little background so you guys can understand where these financial programs came from. So, we all heard of Obamacare. It is the Affordable Care Act. And that went into play in 2010. It was part of Obama's affordable health care to offer to the communities. He actually put several different branches in. The state of Colorado was one to pick up the Affordable Care Act before a lot of other states picked it up. In the state of Colorado, we actually go off of 133% of federal poverty level for Medicaid, and a lot of you are familiar with that. I'm not really sure who makes up the federal poverty level. I always tell people that's probably like Santa Claus or somebody, and that we don't know about. But the federal poverty level is set each year, and 133% of it and below is what you would use to qualify to get on Medicaid. These programs were set so that it covers other people that cannot get on Medicaid. So we have a couple of programs that will go up to, one will go up to 250% of federal poverty level, and the other will go up to 400% of federal poverty level. These programs aren't only specific to Southwest Health Systems. There are a lot of programs that are going to be specific to a hospital that takes Medicare and Medicaid. Okay, so Mercy, which is managed by Centura Health. Centura is huge, so they do a lot of the Catholic hospitals in the state of Colorado. So this is not just information that's going to be helpful to your clients that are in Montezuma County, but also in other counties, and will help if they are transferred to larger hospitals, okay? Because a lot of times, especially for the working class who do have insurance, we've got a really high deductible, and then we've got our co-insurance. We also have seniors who don't have Medicaid, and they just have Medicare, and then they're looking at their deductible and their 20% co-insurance. So a lot of these guidelines that I'm going to share with you will have to do, be helpful to understand and recognize, so that you guys kind of get the gist of how can I help these people pay for health coverage, because we all know healthcare is not affordable. It doesn't matter how many acronyms there are out there. Anybody that's ever visited an emergency room knows that healthcare is not affordable. So I've got a couple of handouts, and I'm just going to pass these around, and then we can follow along with them. I do the Colorado Peak to help patients get on Medicaid. I also can help assist people filling out an application for Medicare savings and for long-term care Medicaid. So those are all encompassed in most hospital settings. So you're in the hospital, or you have a parent in the hospital, or you have a client in the hospital that needs some help filling out those applications, ask for a financial coordinator in that hospital. Okay, if you're at Southwest, you can come and see me. This first program we're going to talk about is called CICP. It is the Colorado Indigent Care Program. It is for Colorado. This is one of the programs that is at 250% of federal poverty level. So if you're eligible for Medicaid, you have to be on Medicaid. But if you're not eligible for Medicaid, you can actually be on this program based off of your income. So these programs are based off of income and the size of your household.
How about age?
No, they're not age restricted. Okay? So anybody that is not eligible for Medicaid, even if they're on Medicare and they're senior, they can actually be on this program that will help them. These are programs, so they're free. They're not an insurance, so it doesn't count as an insurance. Under the Affordable Care Act, they did lift, President Trump did lift the penalty that we were receiving for not having insurance. They did lift it for this year, so you won't get penalized for not having insurance. But there's still gonna be some items that are gonna be necessary for us to at least have some kind of program if you're needing health care, okay?
Can I ask you a
So,
question? So do you have to be in the hospital or been
no,
admitted to the hospital to apply for this?
no, in our hospital, you do not. There
Okay.
are some hospitals that will actually say you have to have a bill before you can apply for our financial assistance. Most of those will be the next program that I'm gonna tell you about. The Colorado Indigent Care Program, anybody can go in and apply for. So you can actually make an appointment, get this program, have the card, and never even use it in a year. But you have it in your wallet just so that you have kind of that safety net. So you can kind of plan accordingly. My insurance is gonna pay after I reach my $5,000 deductible, and then I have 20% of a co-insurance. But I have this program, and because I have this program, my amount out of my pocket is gonna be set. Okay, and I'll tell you more about that after we move along here. So,
But
yes.
I see those providers are mostly your area.
Correct, and these are our brochures, but
Oh.
you can get on this program at Mercy, you can get on it in Grand Junction, you can get on it in Denver. It's usually the public hospitals, the Kaiser hospitals, the private hospitals, they're not gonna offer this type of program because it's a state program.
Okay,
Okay.
thank you.
So, if we look at just the highlights, it's a discount program, it's not an insurance, it's administered by participating providers. Some providers, like our hospital, will use it for all of our services. Mercy seems to only use it for emergency services. Okay, so if you're covered under emergency, go through the emergency room, flown in by a helicopter, brought in by an ambulance. If it is a scheduled service, they're not gonna cover it. You'll have to use some other type of program, and I'm not really familiar with all of their programs. I'm just familiar with these two programs that we share.
Can I clarify something real quick on that? Okay, I had somebody worried about helicopter transportation. So you're saying if they qualified and they were flown to Mercy, they would help?
So if it is a helicopter from Mercy,
From Mercy? Okay,
if it's a private helicopter, they will not.
okay, thank you.
Okay, so, and that's another, the transportation piece is another piece that is, there are private entities that will pick you up if Mercy's helicopters are not available. In Cortez, we have private commercial flights that will actually, not commercial, but private flight airplanes that will fly people to Denver, but they're a private entity too. And
So they
so,
have insurance?
yes. So insurance is what's gonna cover them or their programs,
Well, yes.
okay?
Claim insurance didn't cover it. Okay, thank you.
Uh-huh. So to be on CICP, you cannot be eligible for Medicaid. The income resource combined has to be 250% of federal poverty level and below. You can have Medicare and private insurance, and this program can backdate for 90 days. So you go to the emergency room, you don't know what's offered, you're told about this program, you have 90 days, we can backdate and cover you under these guidelines. Okay? You'll have a copay according to a rating, and then you'll have to renew it, and it'll be your responsibility to renew it every year. Okay, so those are kind of the bullets of it. This next page that you'll see just has a little bit of information. It's kind of small print. We'll kind of cover most of those items as we go along. We'll see the guidelines, and we have a larger, if you'll flip to the back, we have a larger scale that has the federal poverty levels. So you'll see this page with the federal poverty levels, and that's kind of that little small level that you'll see on there. So if you look across this matrix, you'll see a family size of 1. These plans are based off of the next program that we're going to talk about. But in order to be under CICP, you have to be under this first plan of income. So a person with a family size of one cannot make more than $2,602.08 a month or $31,225 a year to be eligible for CICP. Okay, and that's the program that's going to cover all the hospitals in the state of Colorado. So that kind of gives you that matrix, and it's just a little bit larger than this small one, and that's the only reason I flipped forward. Some of the other things that have to do with CICP, they do look at your income and they do look at your liquid resources. So you have a lot of money in your checking account because you retired and you have money saved up in your checking or your savings, but your monthly income is below that poverty level, or in those guidelines, you would not be eligible because they would take into account your resources. So for Colorado Indigent Care Program, they do take your resources.
Do they have an amount, like with Medicaid, you can have a certain amount of resources?
It all adds up to this same dollar amount that's on the level. So you let's say you make $1,000 a month, you're at, well, no, it has to be higher than 1,000. Let's say you make $1,400 because that's higher than Medicaid. Your income would only be, I'm not really great at math, so let's say your income annually is $24,000 a year. You're still in that annual income, but then you have $25,000 worth of resources. We add the resources with your annual income, and that will make you over that annual limit. Does that make sense?
Yeah.
Okay, so your resources will be added to your income, and you still have to be under that annual
Got it. Okay,
dollar
that makes
amount.
sense,
Yep.
thanks.
Okay, so that's for CICP. Now, if you don't qualify for CICP, you can also qualify for FAP, or you can qualify for them both together. So FAP is a financial assistance program. The federal poverty level goes up to 400%. Now you'll see that monthly amount. If you look back at the matrix, you'll see that amount is $4,000 a month. So I'm making $4,163 a month, and I'm eligible for this program. Does that make sense to you guys? So that's FAP. Now we're putting CICP aside. We're looking at the maximum you can make to be on a program. The financial assistance program is something that is offered also under the Affordable Care Act. It was written that said hospitals that take Medicare and Medicaid have to offer a sliding scale, and they just named it the financial assistance program. Almost all hospitals that are in the United States, not just in Colorado, in the United States that take Medicare and Medicaid in their state will offer this program. So you get really sick and you're on vacation and you're in Washington State and you have to end up at the hospital, and each one of us probably have private insurance and our deductible is $5,000, you can ask for the financial assistance program, okay? My mom lives in Ohio and I go see her and all she has is Medicare, but she's put in the hospital and she's been in there now for 14 days and I'm not sure what my amount is going to be after Medicare to help her, and my mom's on a fixed income. You can actually ask for this program, okay?
Regardless
So
of
it's
your
not a
income,
loan.
right?
Yeah, regardless of your income, as long as you fall in the 400% range, okay? Now this program in our hospital, some hospitals are different, does not count liquid resources. So I have taken my 401k and I'm living off of it, and my retirement, and I sold my house, and so now I've got $30,000 in my savings account. This program only goes off of your monthly income. So your resources aren't counted under this program at all. And so you're eligible for this kind of a discount. So if you look at this scale again, Plan 1 at our hospital, you get a zero copay. So anything that has to do with our doctors or our hospital, you get a zero copay. So your insurance is going to cover whatever's left over. There'll be nothing out of your pocket. You can also use our pharmacy at the hospital and you'll get your meds for $5. Is if you have this program. For Plan 2, you'll see up at the top, your copay for a doctor is $15. You will be discounted after your insurance. So your insurance pays everything besides $1,000. We're gonna discount that again at 80%. You'll pay 20% out of your pocket. And you'll get your doctors for $15 and your pharmacy for $10. So that's how the sliding scale works. This same sliding scale is going to be available at other hospitals. They do have the FIP program at Mercy. They do have the FIP program at St. Mary's. They do have the FIP program in Farmington at San Juan and in Monticello at San Juan. So remember to ask for that when you have clients who are, because the big part of knowing how I'm going to get better when it comes to healthcare is financial. I'm not going to go to the doctor. And if I go to the doctor, I can't afford my meds. And if I try to get my meds, because I don't have Medicare Part D, I've got to choose between getting my meds and buying my groceries. So remember, there are other options that you can ask for. Just ask for the financial coordinator to help you with those items, okay? The stuff that I have here basically applies to Southwest. Each individual hospital has their own type of plan. So their sliding scale may not equal the same percentages and copays and have pharmacy attached to it. And they may ask for different documentation than what I have, what I ask for in my facility. And then there are other types of items that people don't always tell you about when discounts that you can get when you're dealing with healthcare. You can ask for a cash pay discount. I have no insurance at all. I can ask for a discount. The discount here is showing 25%. We've actually increased that to a 50% discount cash pay at Southwest. So you come in, you get lab drawn, you get a 50% discount cash.
You don't have to bill insurance.
Yep. Don't have to deal with the insurance company. We're not going to bill the insurance company. If you want to bill your insurance company, you have to bill it on your own. There's payment plans. Hospitals don't charge interest. So there's a payment plan. As long as you're making that payment each month, they're not going to send you to a collection agency. They're going to set you up on a payment arrangement. They may ask for a certain amount each month. Most of the time they'll work with you. A lot of those places, you'll get a separate bill. You have an x-ray or an MRI or a CAT scan done, you'll get a bill from a radiologist. Those radiologists will also negotiate with you. So just keep that in mind when you're talking to your patients. They have all these bills and they don't understand. They get an explanation of benefits from Medicare, they get an explanation of benefits from their insurance, they don't understand. We're not only talking about people that have Medicare and Medicaid. They may have Medicare and Medicaid, but it's a Medicare savings. And it's not a Medicaid that actually covers what Medicare doesn't cover. So if they have questions, have them talk to somebody at that healthcare facility. I think that's it. I try to cut it short. Does anybody have any questions?
You do a lot.
I don't know if this is.
It really is so interesting, and it applies to every one of us. One time or another, we're going to be skiing and we're going to twist our ankle. We're going to have to help our parents or our clients or somebody that we need to know what are our options when it comes to affordable health care.
Say they have 80% covered by Medicare, they don't have the 20%, but they haven't met their deductible. Okay, Medicare has a lower deductible. Say they have ACA and they haven't met a deductible. Does that influence this at all? I'm probably just confused, but.
Yeah, they have, tell me again.
So they have some insurance, but they're gonna have a bigger bill because they haven't met their deductible.
Correct.
They can
Correct, they can apply for that. Mm-hmm. Yep, you can have, I've had patients who have 3 insurances, They have Medicare and then they have a supplement and then their husband has a supplement that they cover, they're under, but it still doesn't cover everything. Every year our deductibles increase. We're seeing right now in Montezuma County, we're seeing one of the only carriers that we have is Blue Cross and Blue Shield. They're the only ones that'll cover us. The other thing that we're picking up this year is the Connect for Health, and that is the tax credit, and I don't know if you guys are familiar with that, but most places that we work for offer health insurance, but there are some times that will offer health insurance for the employer, but not for our spouses, and our spouse needs health insurance. So you can actually get a tax credit to help pay for your health insurance for your spouse through Connect for Health, which is a tax credit base. Basically what it is if you have a plan that is $1,000 a month for your premium, and so that means you're going to pay $1,000 a month to have Blue Cross and Blue Shield insurance, you can get a tax credit based off of these same guidelines at 250% of federal poverty level, get a tax credit that will help pay for those premiums. So you could actually get that premium lowered down to 0 or 200 or 400, so it decreases the amount of your insurance premium and you actually have an insurance. There's a whole nother realm for patients who are Native American and living, that they can get their affordable tax credit for free. So all of those things are very confusing, but if you guys have any questions on them, you can actually send them, because it's on an individual basis.
So if you have dependents, up to what age do you cover them?
So if they're in school, you can cover them up to the age of 25 if they're still in school. Yep. And they're on your taxes, so you're claiming them on your taxes. If they're not in school and they're living in your household and they're working on their own and they're filing their own taxes, then they're actually considered an individual, and so that is, they can actually be eligible under their own resources.
Does it matter if their school is out of state or in state?
It doesn't matter. What matters is the type of insurance they're going to get.
Oh, okay.
Mm-hmm. So they're not eligible for Colorado Medicaid if they're not living in school in Colorado. If they're getting the tax credit, they have to be using the state insurance in Colorado because it won't cover outside of Colorado. So each individual is going to be different. All right. Thank you.
Thank you. Does anyone have any other questions for me?
Okay, let me just ask this. Pagosa Springs Medical Center is private? Do you know?
I'm sorry?
Pagosa Springs Medical Center?
No, they take Medicare.
No, but I mean, are they private? Would they do this program?
Yes.
Oh, okay.
Any hospital or clinic that takes Medicare, Medicaid.
Okay.
We're talking private, privately owned facilities like a Kaiser Hospital or something that does not accept federal dollars.
Oh, okay.
Mm-hmm.
Southwest Memorial under Centura, is that Centura?
Nope, Southwest Memorial is
Or is it Pagosa
private.
Springs at Centura? Isn't Pagosa
No,
Springs
Mercy
that?
is.
Mercy is.
So Mercy Centura?
St. Mary's is.
She said they take it.
Yeah, most Catholic, right?
Yeah.
But they'll still take it. Right?
Yes. Yep.